Have you noticed how your body feels different since menopause, maybe more dryness, discomfort, or even pain during intimacy? You might wonder, is this just part of aging? Do I have to live with this forever? The truth is, these changes are very real, and they are directly tied to the shifts in hormones your body experiences after menopause. Understanding how hormones affect your vaginal health is the first step toward finding solutions that restore comfort and confidence. Many women feel embarrassed to talk about these issues, but I want you to know you're not alone. In fact, more than half of women after menopause experience vaginal symptoms related to hormonal changes. And the good news is, once you understand what's happening, there are effective ways to help. Hello, I'm Dr. Lisa Perriera. For more than 30 years, I've had the privilege of caring for women through all stages of life, and one of the most common concerns I hear from women after menopause is, something feels different down there. I've seen women lose confidence, avoid intimacy, or even skip social activities because of vaginal discomfort. My mission is to help you understand why these changes happen and to reassure you that there are answers. Today, we'll explore how the hormonal shifts of menopause affect your vaginal health, what symptoms you might notice, and what steps you can take to feel better. Before we dive in, I'd love for you to subscribe to Elder Care Wellness. This is a community for women over 50 who want compassionate, evidence-based guidance to stay healthy, strong, and confident. If you've ever experienced dryness, irritation, or infections since menopause, leave a comment below. Your story might give another woman the courage to seek help and realize she's not alone. So let's begin with the most important hormone in this story, estrogen. Estrogen plays a central role in keeping your vaginal tissues thick, elastic, and naturally lubricated. It helps maintain healthy blood flow to the area, keeps the tissues rich in collagen, and supports the growth of beneficial bacteria that protect against infections. When estrogen levels decline after menopause, all of these protective factors start to diminish. The vaginal lining becomes thinner and more fragile. Lubrication decreases, leading to dryness. Blood flow slows, so tissues don't repair as easily. This combination creates what doctors call genitourinary syndrome of menopause, or GSM. Research from the North American Menopause Society shows that up to 60% of postmenopausal women experience GSM. Symptoms include dryness, itching, burning, and pain during intimacy. Some women also notice more frequent urinary tract infections because lower estrogen allows harmful bacteria to grow more easily in the urinary tract. These symptoms can feel frustrating and even isolating, but they are not a reflection of your health choices or personal hygiene. They are simply the result of your body adapting to a new hormonal environment. I recall a patient in her late 50s who came to me feeling distressed. She told me intimacy with her partner had become so painful that she avoided it altogether, and she worried this meant the end of closeness in her marriage. After explaining that her symptoms were linked to estrogen decline, we worked on a treatment plan together. With vaginal moisturizers and later low-dose estrogen therapy, she regained comfort within a few months. At her follow-up, she smiled and said, "I feel like myself again." Stories like hers remind me how powerful it is to understand the root cause of these changes. Estrogen isn't the only hormone that plays a role. Progesterone, which also declines after menopause, influences vaginal tissue balance, though its role is less pronounced than estrogen. Testosterone, though present in much smaller amounts in women, also drops with age. Lower testosterone can affect sexual desire and may contribute to changes in tissue sensitivity. Together, these hormonal shifts can leave you feeling like your body is unfamiliar. But once you recognize that these changes are hormonal and not just in your head, you can begin to take steps to support your vaginal health in meaningful ways. So the first big idea is this declining estrogen after menopause sets the stage for vaginal dryness, thinning, discomfort, and increased risk of infections. Understanding this link is crucial because it helps you realize that your symptoms are not your fault, and they are not something you have to silently endure. In the next part of this video, we'll dive deeper into the specific ways these hormonal changes show up in your daily life and what you can do to start addressing them. When estrogen levels drop after menopause, the changes in your vaginal health can show up in many ways, some subtle and others impossible to ignore. One of the most common symptoms is persistent dryness. Without enough estrogen, your vaginal walls no longer produce the same natural lubrication they once did. What used to feel soft and moist may now feel dry, tight, or even scratchy. Many women describe a constant awareness of discomfort, almost like wearing clothing that doesn't fit right. This dryness isn't just inconvenient, it can make intimacy painful, sometimes leading women to avoid closeness altogether. And unfortunately, this avoidance can create tension in relationships, leaving both partners feeling confused or disconnected. Another key change is thinning of the vaginal tissues, often called atrophy. Estrogen helps keep tissue thick, elastic, and able to stretch without tearing. When that support is lost, the tissue becomes delicate and fragile. Even simple daily activities like sitting for long periods, riding a bicycle, or walking can cause irritation. Some women notice small tears after intimacy, which not only cause pain, but also increase the risk of infection. According to the Mayo Clinic, these tissue changes are among the most consistent effects of menopause, yet many women never mention them to their doctors because they think it's simply part of aging. The silence around these symptoms means they often go untreated. Another consequence of hormonal changes is an increased risk of infections, particularly urinary tract infections, UTIs, and yeast infections. Normally, estrogen helps maintain a healthy balance of bacteria in the vagina, dominated by protective lactobacillus. These bacteria keep the vaginal environment slightly acidic, which prevents harmful organisms from taking hold. After menopause with less estrogen, the balance shifts. The vagina becomes less acidic, making it easier for bacteria to grow. This is why many women suddenly notice UTIs becoming more frequent in their 50s and 60s, even if they never had that problem before. Recurrent infections aren't just uncomfortable, they can affect your overall well-being, leaving you exhausted, frustrated, and anxious. I recall one of my patients in her early 60s who came to see me after her third urinary tract infection in a single year. She was diligent about hygiene, drank plenty of water, and couldn't understand why she kept getting sick. When I explained that falling estrogen levels were altering her vaginal environment, she felt both surprised and relieved. "I thought I was doing something wrong," she said. With the right treatment, her infections became far less frequent, and she told me she finally felt like she had her life back. Her story highlights how understanding the role of hormones can replace shame with empowerment. Beyond infections and dryness, hormonal changes also affect sexual function and desire. Estrogen and testosterone both play a role in sensitivity and arousal. When they decline, many women report less interest in intimacy, not because they don't love their partners, but because their bodies no longer respond the same way. This can create a cycle of frustration, less arousal, leads to more pain during intimacy, which leads to avoidance, which can affect self-esteem and relationship closeness. It's important to remember that these changes are biological, not psychological. You are not imagining things, your body is simply responding to new hormonal realities. And just as there are solutions for dryness and infections, there are also strategies to support desire and intimacy. Another symptom tied to hormonal decline is burning or irritation, sometimes even without activity. Women describe it as a raw or itchy feeling, almost like having a constant mild infection, even when tests show nothing is wrong. This irritation is simply the result of thinner tissue and reduced blood flow. Some women find it so uncomfortable they avoid exercise or social activities. Left untreated, this can take a toll not only on health, but also on confidence and independence. I've met women who told me they stopped traveling because they worried about discomfort, or who gave up favorite hobbies like cycling because it became too painful. These are losses you should not have to accept as permanent. So to summarize the hormonal changes of menopause, particularly the decline in estrogen cause dryness, thinning of tissues, increased infections, reduced sexual desire, and persistent irritation. These symptoms are common, but they are not inevitable. They are signs your body is adapting to a new hormonal environment. By naming them and understanding them, you can begin to seek real solutions instead of silently suffering. In the next part of this video, we'll explore those solutions, what medical treatments and lifestyle changes are available to help you restore comfort, reduce infections, and regain confidence in your vaginal health. When symptoms of dryness, irritation, and infections become part of your daily life after menopause. The good news is that there are effective medical treatments available. The first and most widely recommended option is low-dose vaginal estrogen therapy. Unlike systemic hormone therapy, which circulates throughout your whole body, vaginal estrogen is applied directly to the tissues that need it most. It comes in several forms: creams you apply inside the vagina, tiny tablets, or flexible vaginal rings that slowly release estrogen over time. Because the dose is low and local, the amount that enters your bloodstream is minimal. This makes vaginal estrogen safe for most women, and studies from the North American Menopause Society show that it dramatically reduces dryness, restores elasticity, and lowers the risk of recurrent infections. One of the most common fears women share with me is, if I use estrogen, won't it increase my risk of cancer? It's an important question. While systemic hormone replacement therapy can carry certain risks depending on your health. History. Local vaginal estrogen is considered safe for most women, even those who cannot use systemic therapy. According to the Mayo Clinic and the American College of Obstetricians and Gynecologists, the low dose used in vaginal therapy does not significantly raise risks of breast cancer, blood clots, or heart disease. That said, every woman's situation is unique, which is why it's important to discuss your history with your doctor before starting any treatment. Another option for women who cannot or prefer not to use estrogen is non-hormonal therapies. Vaginal moisturizers used regularly every 2 to 3 days help restore hydration to tissues, while lubricants used during intimacy reduce friction and pain. These products don't change hormone levels, but can provide real relief. In recent years, a medication called ospemifene has also become available. It acts like estrogen in vaginal tissues, but is not actually estrogen, making it a good option for certain women who need alternatives. For recurrent infections, probiotics and prescription therapies may also be part of the plan. I recall a woman in her mid-60s who felt devastated because intimacy had become too painful. She was convinced her marriage was suffering because of it. After explaining vaginal estrogen therapy, she decided to try a low-dose cream. At her 3-month follow-up, her tears were replaced by a smile. "I can finally be close to my husband without pain," she said. Stories like hers remind me why addressing vaginal health is not just about physical comfort. It's also about emotional well-being, confidence, and connection. Some women explore newer treatments like laser or radiofrequency therapy designed to stimulate collagen and blood flow in vaginal tissues. While some women report improvement, these therapies are still being studied, and not all medical organizations endorse them yet. If you're considering them, be sure to choose a reputable clinic and discuss the risks and benefits with a gynecologist who understands your history. For now, Tried and true options like vaginal estrogen remain the gold standard, but innovations on the horizon may provide additional tools in the future. It's important to remember that there's no single right solution. For some women, a regular moisturizer and occasional lubricant are enough. For others, prescription therapy makes the biggest difference. What matters most is not suffering in silence. Too many women wait years before seeking help, thinking nothing can be done. But when you bring up these symptoms with your doctor, you open the door to relief and a better quality of life. So medical treatments are available, effective, and safe for most women. Whether you choose local estrogen, non-hormonal alternatives, or newer therapies, the goal is the same: to restore hydration, elasticity, and comfort to your vaginal tissues. In the next part of this video, we'll discuss how lifestyle choices like diet, exercise, and everyday habits also influence your vaginal health after menopause and can work hand in hand with medical treatments to give you the best results. Medical treatments are powerful tools, but your daily lifestyle choices also play a huge role in how your vaginal health feels after menopause. Think of them as the soil that supports the plant. Even if you add the right medicine as fertilizer, the plant won't thrive unless the soil is healthy. By focusing on nutrition, movement, stress management, and gentle care, you give your body the foundation it needs to respond well to treatments and stay resilient for the long term. One of the most important lifestyle factors is nutrition. Diets rich in whole foods, fruits, vegetables, whole grains, lean proteins, and healthy fats supply the vitamins and antioxidants your tissues need for repair. Omega-3 fatty acids from salmon, flax seeds, or walnuts reduce inflammation and support blood flow to vaginal tissues. Colorful produce provides vitamin C for collagen and vitamin A for mucous membranes, both essential for keeping tissues strong. On the other hand, high sugar or highly processed diets feed yeast, raise blood sugar, and increase inflammation, all of which worsen dryness and infections. By choosing nourishing foods, you are fueling your tissues with exactly what they need to stay healthy. Exercise is another pillar of vaginal health. Moving your body boosts circulation, ensuring oxygen and nutrients reach the pelvic area. Regular activity also helps maintain a healthy weight, which lowers estrogen imbalance and reduces inflammation. Practices like yoga and Pilates strengthen your core and pelvic floor, supporting the organs in your pelvis and improving bladder control. Even a daily 20-minute walk can make a difference. I once worked with a woman in her late 50s who began walking every morning after breakfast. She told me that not only did she feel stronger, but she also noticed fewer bladder leaks and greater comfort overall. The body thrives when it moves. Stress management is often overlooked, but it directly affects your hormones. Chronic stress raises cortisol, which can disrupt your immune system and make you more vulnerable to infections. Many women notice that their vaginal symptoms flare during stressful times. Incorporating practices like deep breathing, meditation, journaling, or gentle stretching helps calm the nervous system and gives your pelvic tissues the chance to heal. Stress reduction is not just for your mind, it's medicine for your body. Gentle hygiene practices also matter. Overwashing scented soaps or douching can strip away natural protective bacteria and irritate already sensitive tissues. Instead, use mild, fragrance-free cleansers only on the external area and let your body's natural balance protect the inside. Wearing breathable cotton underwear and avoiding tight clothing helps reduce irritation. Small shifts like these may seem minor, but for women with delicate tissues after menopause, they often bring surprising relief. I encourage you to pause and reflect which lifestyle change feels most doable for you right now. Maybe it's adding berries to breakfast, taking a short evening walk, or swapping scented soaps for gentler ones. Every small step matters. I've seen women who started with just one change build momentum and feel better than they had in years. Share in the comments what habit you'd like to begin with. Your idea may inspire another woman who is watching and wondering where to start. So lifestyle choices are not optional add-ons. They are central to how your vaginal health feels after menopause. By nourishing your body, moving regularly, managing stress, and caring gently for your tissues, you create an environment where medical treatments can work even better. In the final part of this video, we'll bring everything together, summarize what we've learned, and close with encouragement for your journey forward. We've now walked through the journey of how hormone changes after menopause affect your vaginal health, and it's time to bring all the pieces together. The most important message I want you to remember is this: the changes you've been feeling. Dryness, irritation, more frequent infections, or discomfort during intimacy are not signs of weakness, and they are not things you must simply accept. They are the natural result of declining estrogen, progesterone, and even testosterone. These hormones once acted like quiet guardians, keeping your vaginal tissues thick, elastic, hydrated, and protected. When they diminish, your body responds with changes that can feel surprising or discouraging. But once you understand the cause, you can take steps to find real solutions. We learned that estrogen is the key player. Without it, the lining of the vagina becomes thinner, less flexible, and more prone to tears or infections. Blood flow decreases, lubrication slows, and the delicate balance of healthy bacteria is disrupted. Progesterone and testosterone also shift, adding to changes in sensation, arousal, and tissue health. Together, these shifts create what doctors call genitourinary syndrome of menopause, a collection of symptoms that affect more than half of women after menopause. Knowing that these symptoms have a name and a medical explanation can be comforting. It reminds you that you are not alone, and you are not imagining things. The good news is that effective treatments exist. For many women, low-dose vaginal estrogen provides profound relief, restoring hydration, elasticity, and balance with minimal risk. Non-hormonal options like moisturizers, lubricants, and newer medications can also bring comfort. Medical innovations from vaginal rings to laser therapies offer even more possibilities for women seeking alternatives. What matters most is breaking the silence and having open conversations with your healthcare provider. The moment you speak up is the moment solutions become possible. We also explored how lifestyle choices matter. Nourishing your body with omega-3s, colorful fruits and vegetables, and fiber-rich foods helps reduce inflammation and balance your microbiome. Regular exercise supports circulation and strengthens your pelvic floor. Stress management keeps your immune system strong and your hormones steadier. Gentle hygiene protects fragile tissues. These everyday choices, while simple, build the foundation for long-term comfort and resilience. Together with medical therapies, they create a powerful strategy for protecting your vaginal health after menopause. I've had the privilege of seeing women in their 50s, 60s, and 70s rediscover comfort and confidence by making these changes. Some once thought intimacy was behind them, only to find joy restored in their relationships. Others, who struggled with frequent infections, regained peace of mind and energy for the activities they loved. These transformations remind me that it is never too late to care for yourself. Your body is capable of healing and responding positively even decades after menopause. So as we close, I invite you to reflect, what small step can you take today? Maybe it's scheduling that long-delayed conversation with your doctor, picking up a gentle moisturizer, or adding a short walk to your routine. Every action, no matter how small, is a statement that your health matters, and you deserve to feel comfortable, confident, and connected to your body at every stage of life. Thank you for spending this time with me. If you found this video helpful, please leave a comment below. I'd love to hear your experiences and questions. Share this video with a friend or sister who might also be navigating these changes. And if you haven't already subscribed to Elder Care Wellness, where we bring you trusted, compassionate advice each week. Remember, your journey through menopause is not an ending, it's a new chapter. By understanding your hormones and supporting your body with care, you can step into this chapter with strength, balance, and peace of mind.